Suzanne Gordon, and I'm going to just talk a little tiny bit about our book and about this report that we just did. I'm a co-founder and senior policy analyst at the Veterans Healthcare Policy Institute, which is a think tank to protect veterans healthcare and also all of us. And so I'm going to just do a very quick little quiz here. How many of you know that the Veterans Health Administration doesn't just give clinical care to veterans, but actually creates models of care that should inspire our entire healthcare system? How many of you have ever heard about the integration of mental health and primary care? Great. How many of you know that the Veterans Health Administration serves all of us, not just veterans, by being the hub of the nation's healthcare training, professional training system, right? VA trains how many percent? How many know? The quiz. How many percent of American physicians?
I think close. I thought it was almost 100.
70%. VA employs more psychologists than any other system in the country, more social workers, anthropologists. They train, they're the hub of the healthcare professional training system. Anybody here get the first shingles vaccine? Thank you, VA.
Okay.
Anybody know somebody with an implantable pacemaker? Thank you, VA. VA research is central to all of us. So, if the veterans healthcare system, this is so important. It's our system, right? I mean, it's the system for veterans that serves the entire nation, not just veterans. And I think not enough folks know about this, and so that often I think when people talk about save the VA, they think it's just for this tiny sliver of the population, but it isn't. It's a public healthcare system for all of us. And finally, anybody here know about the VA's fourth mission? Fourth mission? So basically, the VHA has a mission to serve as a backup to the nation's broader healthcare systems in times of war, terrorism, or national, regional, or local emergencies. So during COVID, the VAs in New York State received non-VA patients when those hospitals were overwhelmed. They sent people to take over nursing homes. It was, it's an incredible system. And I think it's really important for folks to understand that, because very often, I think a lot of people, they see VA hospital and they think, oh, what goes on in there is only for veterans. And so when you're disadvantaging the VA, which is what the title of this report is, you are disadvantaging all of us. You're cutting research, you're cutting teaching, and also healthcare outcomes. I mean, kept talking about the healthcare outcomes. They deliver better healthcare outcomes with one hand tied behind their back, right, than the American healthcare system. I mean, just one recent study, and this is why we need, in my view, VA for all, as well as Medicare for all. But in one recent study, 500,000, they looked at the outcomes of care for 500,000 veterans who were taken by ambulance either to a private sector hospital or a VA hospital. And the veterans who were taken to private sector hospitals in the first 28 days were twice as likely to die from an emergency than those taken to VA hospitals, and their care cost 21% more. Wow. And I read that study and I'm like, how come I can't go to a VA hospital? Like, how come everybody in this room who's not a veteran can't go to a VA hospital? That's the system they want to kill. They are, and it's Democrats and Republicans. This budget, the new FY 2024 budget, so they create the privatization scheme that we describe in this book goes under the name of the VA Mission Act of 2018. That's what Kim just described. and Alton's, fighting to the effects of. And this is a legislation that was supported by an overwhelming number of Democrats as well as Republicans, and it outsources care to the private sector. It's a complete scam. It's a scam like the privatization of Medicare, right? The exact same forces who are trying to privatize Medicare are trying to privatize the VA. Why? Because there's a $128 billion pot of money that they want to take to the private sector. Right now, in the budget, the budget now, over the past, between 2017 and 2021, the amount of money we taxpayers are spending on private sector care for veterans that is of lower quality with more delays has increased by 116%, the amount of money we're giving the private sector. The amount of money we've given to the VA for in-house care has increased by 32%. In the FY 2024 budget, between 2023 and 2024, the increase in money going to private sector care has increased by 25%, the increase going to VA care in-house 5%. That's theft. Because the care is, what studies show, is less good. And from the point of view of VA employees that we survey, the Veterans Healthcare Policy Institute worked with the National VA Council with the AFGE and the Federation of Government Employees, who Alton is here to talk about. We surveyed 90,000 employees who work for the Veterans Benefits or Healthcare Administration. And they tell you that they're short-staffed, that they're being diverted from taking care of veterans to acting as insurance company utilization reviewers to oversee private sector care. The evaluation exams, they're called compensation and pension exams, that the Veterans Benefits Administration uses to evaluate whether folks like Ken or any veteran in this room can get financial compensation and also access to VHA care, is now being privatized. They're sending them out to for-profit companies as opposed to VHA employees that know what they're doing, know complex military problems. And the VBA people that we interviewed, surveyed in this report that these evaluations are so badly done that they have to send them back and they can't make adequate assessments. So this is a staggering problem that not enough folks are aware of. And our appeal, we believe that in this report we talk about a number of things that have to be done: fully funding and staffing the VA, reversing the dramatic outsourcing of veteran care to the private sector. Here's a wonderful scam. If you, under the Mission Act, this privatizing legislation, if Ken calls and gets an appointment tomorrow for telehealth for something that he needs, that doesn't count as access to care under the Mission Act standards. If Ken gets a private sector telehealth appointment in 3 weeks, that counts as access to care. The VA secretary, yes, you kind of all look puzzled. It's outrageous. It's just a total, it's disadvantaging, deliberately rigging the system, right? The VA secretary says we have to have healthy competition between the private sector. Well, how do you compete when you're paying for the competition? You're a football team and you're saying, don't come to our game. We'll pay for you to go to the opposition, and then they won't let you stay at the Patriots, if you don't wanna go to the Jets, I shouldn't be using that.
You're on thin ice, Suzanne.
Oh, the Patriots.
Anyway, the VA secretary, everybody in this room needs to call their political representatives and say, why are you disadvantaging the VA? Why are you giving more money to the private sector than the VA? Why are you sending veterans out? Why are you counting telehealth as an access, as an appointment when it's delivered by the private sector and not by the public sector, right? So this can be reversed. We had a major victory thanks to the American Federation of Government Employees and groups like ours and Sool, the Save Our VA group and Veterans for Peace. We beat back a national effort to shut down a third of the nation's VA hospitals. We beat that back. It was called the AIR Commission, the Asset and Infrastructure Review Commission. We can beat this back and expand the VA. We believe every veteran should be covered by the VA as opposed to these crazy eligibility requirements that keep people from care. We believe that family members of veterans should be covered. We believe that even veterans' communities should be covered. And imagine, there's a debate within PNHP and other healthcare reform groups about incrementalism, and in my view, there's sometimes we can be a little too pure. But imagine if the VA healthcare system were expanded so every veteran, all 19 million veterans could get in, regardless of discharge status, regardless of whether they had a proven service-connected disability, regardless of income. Imagine if they're family members. That would be 40 to 60 million people covered by socialized medicine in this country. That's a pretty good platform. And veterans have a lot of moral and ethical standing. And getting, 40 to 60 million people saying, save our VA, we want to expand our VA is a pretty good starting point for getting the healthcare system that we all deserve in this country, because I believe, I have written a book, Wounds of War, about VA healthcare. I know exactly the providers I would like to go to in the VA. I sometimes get them to treat me on the phone. I got a supraspinatus impingement diagnosed by my friends in Chicago, right? I mean, it's a joke when I couldn't get into my provider. Why? Because I was 10 minutes late to an appointment, and she wouldn't see me. 10 minutes late. We all deserve this. This is, incredible. So I want to give the floor, I want to implore you to, when you're fighting for Medicare for all, save the VA, right? When you talk to congressmen, save the VA, because if we cannot save the VA, we're not going to get anything. If we can't do that, right? So I would like to give the floor to Alton from AFGE, and then, 100,000 veterans work for the Postal Service. I have to say another thing about the VA. The Veterans Health Administration, has over 300,000 employees, a third are veterans. The VBA has 27,000 employees, a third are veterans. So you want to shut down the VA? You're putting 100 and whatever, 10,000 veterans out of work tomorrow. Really, that really is a way to thank you for your service. And ditto with the Postal Service, right? 100,000 veterans work for the U.S. Postal Service, which they also want to privatize. So I give you the floor.
Thank you all. My name is Alton McDonald. I am the local president for Local 1128 out of VBA, and it's right over here for Jackson Ferry Building. And so I was hired as a rating veteran service representative, and I adjudicate claims that are filed by the veterans and give them their rating based upon the medical evidence of record. And so by doing so, if the examination on a comprehensively properly done, then becomes a problem for that veteran who's waiting for his or her benefits. So when we talk about privatization, we're talking about taking away work from the hospital to give it to private organization who don't sometimes know nothing about the veteran themselves that they're seeing. And sometimes they see the veterans, sometimes even for maybe a quick 5, 7 to 10 minutes, and then everything is done is written up. As a disservice to the veteran, right? So when we get those reports, those medical records, to conduct a analysis of the medical information that's there according to the claim condition of the veteran, it becomes very challenging for us. Oftentimes we have to defer that case or the claim, send it back to the medical provider and ask him for correction or asking certain questions related to the claim itself. So when we say Save My VA, it's not just the VHA side of the house, it's also VBA, the benefit part of the house. For God and for country, on behalf of a grateful nation, for those of us who have served, I myself was a veteran, and I waited almost 2 years for my benefits. I couldn't understand the reason why I was taking the VA so long. They gave me the benefits I so rightly deserve or earned, so to speak. But after getting to work at the VBA, I could understand the reason why. And so when we work and deliver our rating and adjudication for cases, we treat not just as a case, we treat the cases not as a number, but as a person. And we try to be very personal with the claims that we deliver to the veterans as related to for their services and also for the benefit that is so rightly deserved. So we are doing an excellent job. Others may not see it that way because a lot of veterans have said, oh, I've been waiting a long time for my benefits. You know, why is it taking the VA so long to get me my benefits? And sometimes it's a challenge for us to work on the inside. But if you're on the outside looking in and don't understand what's going on the inside, you think it is the employee, but in fact it's not us. Privatization came very close to the VH and the VBA during the Trump administration. If you dislike veteran, then you dislike your country. Go we, the veterans who serve in the military, make this country the way that it is today, so that we can enjoy this great nation. And so, with the Trump administration privatizing the VHA, as you all remember, when during the COVID epidemic, I should say, where the hospital community was overrun with civilians who were infected by this disease, right, by this virus, I should say. And outside of that, the VHA was having a problem of getting PPE from the government that were there to provide it so that our veterans could get the service that they so rightly deserve. So it was a challenge. The VBA side of the house, where because of the metrics and the performance standard that's in play, make it very challenging for us. And sometimes we don't get the appropriate training that we should get to adjudicate the cases so that we can make the right decision on the claims. So outside of that, the government make it so challenging for us so that they could take away our job and give it to the private sector to do the work that they say we cannot do. And we've been doing this work over for decades, right? So it's a challenge. And so when we say save the VA, we talk about the VA comprehensible, VHA and the VBA. We call it one VA, serving our nation's veteran. And outside of that, providing resources also to address other issues in our community. I want to thank you.
Thank you. All right, we have 2, possibly 3 more speakers, and we're going to open it up. Is Andy Wellens here? Okay, Andy. We're going to hear next from Virgilio Goze from the National Association of Letter Carriers. We're going to hear from Andy Wellens, who's a Navy veteran on the board of PNHP, Washington State, the VA patient. And we're going to hear from Sool, who's here from Congressman Jayapal's office, who has been leading the fight against the undermining of traditional Medicare by Medicare Advantage plans. And so 3 minutes from each of you, and then we can throw it open. The Postal Workers fight is really critical and needs a lot more community support. So why don't you tell us, Virgilio, what's going on with the Postmaster General DeJoy, yet to be fired by President Biden.
Yeah, you don't even have any insight into that?
Well, we're a bipartisan union, all the hack track issues. But, that
Keep your
aside,
mask on.
I guess. Sorry, this is just funny to me every time this issue comes up. Anyway, so yeah, my name is Virgilio Goze. I'm with the National Association of Letter Carriers, Branch 79 in Seattle. We represent letter carriers across the Puget Sound. So I want to talk about like I'm hearing you guys' stories here about like privatization push. A lot of it, like for the Postal Service side, anyways, started from the 2006 law, the FIA law that burdened us with a lot of healthcare retiree that eventually was being used to attack the Postal Service, and at least with the support of the public, after 10 years of fighting that, the Congress passed the Postal Reform Act in 2021 and got a lot of much needed reform. It integrated our retirement benefit for the healthcare side with the Medicare, actually. That's going to be implemented with 2025. If there's any employees here, federal employees here, knows about the federal employee health benefits. It's going to be transformed for the postal side into the postal employee health benefits to try and help us gain that footing for the future for our future retirees. As for the changes, that I want to talk about, the Postmaster DeJoy's 10-year plan has introduced this thing called the sorting and delivery centers, where they're going to try and move some letter carrier functions out of the local postal service into these giant Amazon-style warehouses, which would increase travel time by 20 minutes from the station to where our routes start. So, if you look a few years down the line, if we remove letter carrier activities from the local postal service into these giant facilities, what happens to the local postal service? You're going to have clerks left there, and then we can start arguing, hey, we have all this space in the postal service. What are we going to do with all this space, right? We can move things and shorten the amount of times that clerks have to the public. But it is what it is. The fight is constant. Understaffing is also, I heard from you guys, it's a constant problem in the Postal Service. Mail delivery, we're under the new law, we're supposed to be having a 6-day standard. Some mail isn't being delivered in 6 days. Literally, routes are not being delivered across the country. I'm just lucky that, I've raised hell here in Seattle that they're sending carriers to my station to help folks. And it took a lot of public pressure to try and just get letter carriers to my station, specifically Wallingford Station. Our branch president encouraged me to talk to the Seattle Times. It was in front of the Seattle paper at the Sunday Times back in February about the understaffing crisis in the Postal Service. If you guys read that, but yeah, you can read more about this whole sorting delivery center plan with Postmaster DeJoy from the SaveThePostOffice.com. The fight goes on, and I wish I had more time to talk, but there's a lot of things that are happening. Those, that website is, if you guys want to keep track of what's happening in the Postal Service, the privatization attempts, just go to SaveThePostOffice.com.
Veteran, 6 years in the Navy. Now I'm the comm director, PNHP here. This is such a monolithic topic that I don't know where I would begin to try to make this concise in 3 minutes. But I think the biggest thing is, and I've been using the VA for a year and for a decade and a half, since 2007. I've done it in various states, from California to northern Michigan to here. And simply put, I mean, privatization, and I have friends that have done like what this gentleman's done with adjudicating claims and stuff like that. And I mean, overall, the VA it's a lifeline. It basically absorbs the members of American society that our private system just shuts out.
Yeah.
And so, I mean, I literally know people who are alive, not to abuse the word literally, but I know someone who is alive because of the VA. Like the VA would be the only, and I'm glad that he's alive. And it's a tough job, and I mean, I've met doctors here who they trained at the VA, and then Kaiser's like, hey, we're gonna offer you way more money if you want to buy a house here. So they went with Kaiser. That's your prerogative. But whenever I deal with my doctors at the VA, they're always like, thank you for your service. I'm always like, hey, thank you. And I guess, and I unfortunately, because my spouse can't use the VA, I get to watch why the VA is. I mean, even when I was single, I realized at some point I was just like, man, I'm always happy when I go to the doctor. And it's just like, because you're not going to have surprise billing, you're not going to, the parking is always way better, and the amenities, customer service is
better?
Yes.
at the VA.
Oh,
Yes.
okay.
People show up in their giant 8-cylinder trucks, and there's space. It's not like parking at Trader Joe's where it's all like
Yeah.
fancy, because that's all that's your private, that's your for-profit market-based system. Because my kids were, I had to have my kids birth that Swedish. No offense to Swedish, but I mean, like the parking was not pleasant. I don't know. It's just like, but anyway, I mean, I could go on and on. But when people are like, you want to use the VA? And I'd be like, yeah, if you could use the VA, I don't want anything else, really. I mean, and I have, because some things in the VA, like they don't have an allergy clinic here like they did in West LA, so I have to get that farmed out. And some things are a wait list. And I mean, the so-called, the privatization thing, it always adds a layer of bureaucracy. It adds to the wait times. I can't say it's ever made things swifter, and it's not. And I mean, I used to be I spent time in Wall Street where I would meet people who were like, oh, you have an in. I mean, this is just about guaranteeing income stream for Wall Street. It's not about making us better. I mean, if it happens to make our lives better, that's like a, oh, okay, it happened to make your life better. Okay, cool. But it's really about a guaranteed income stream. And it's like watching my spouse use the for-profit system that America has to use. It's just like every time we go to the doctor, it's surprise billing. It's so stressful. It creates so much mental anguish for the Americans. And we're seeing what happens in America when our mental health is just kind of like going down the drain. But I think the most recent example I could give you would kind of like summarize this. I'm a pretty healthy guy, but in December, unbeknownst to me, I was having like really weird pains in the middle of the night. And I'm someone who, because I'm a veteran, I can handle pain, I was just like, oh, that's probably something I ate that I shouldn't have. And then this was, it takes a lot to make me on the ground writhing in pain. And after about like 4 different nights of that, it was Christmas Eve, and I was finally like, you know what, VA, it's not going to cost me anything to go to the emergency room. I'll just go to the emergency room because it doesn't cost me anything. And then they were like, oh, hey, you have gallstones. It's an emergency, but you need a surgery right now. And I was like, oh, well, good thing the VA didn't like scare me away, because for sure if I was using my wife's insurance, I would have been like, because that's what's pushed upon America is austerity, and it's just like, for the bottom line. And so, that's probably like my best story is the most recent story, but I was just like, and I mean, that's why I work or do what I do with PNHP, because I know that like, at least as long as the VA is there for me, it's such a positive experience. And of course, some things get farmed out to the private sector, and then I do the little scary waivers where they're like, you sign like 10 forms that are like, hey, we will send bounty hunters after you if the check bounces, we're gonna come after you. And I'm always like, oh, cool, I'm very not stressed out before you do this procedure on me. The VA doesn't do that. It's night and day. It's night and day. And it's like, I will say it's a class issue. The people that bash the VA, like, if you use the VA, you're gonna see houseless people using it. I'm always like, that's a good thing, because I see a brief moment, I watch people's mental health improve, because for a brief moment, people are treated like a human being and they're treated with dignity. That's what seeing a doctor is. And that's why it's so absurd that we have this for-market, are you rich enough to see a doctor? Because it's a class issue. And the VA is actually egalitarian, and it's like, sometimes, you see some weird things. You might see some drug addicts. I mean, the day that I was getting my stuff taken care of. The guy right next to me was, I know because I got to use prescription, you know, I was like, but I was like, it's egalitarian, it's universal. Rising tides does raise up all boats, and so I mean that is our way forward. So I mean, I really, you know, anyway, 15 years of experience going on, so I don't know if that puts up my time. You know, one other point, if I could, I feel like, you know, and I had to come late because I had to deal with my kids, but I showed up tonight because one thing that's unfortunate, I have a lot of veteran friends in all 5 branches, and Coast Guard of Manning is number 5. I guess I don't know if it's Space Force, but it says number 6. But I would say that it's unfortunate that most of my veteran friends, they love the VA, but they just go on with their day, and they just so they're not gonna like show like it's. I have to pull teeth to say, hey, can you stand up for the thing that like helps you function? Most of them are. It's like, that's the silent majority. There is that small group of people, but every person I've heard who criticizes the VA, I've been like, okay, can you compare this to the private hospital? Because the wait times, I have never seen a wait time that's bad at the VA that's not better than the private sector. I've never seen that.
Okay, I was curious about some of that.
Yeah, and granted, yeah, I mean, it's like, I mean, like, everybody has a personal anecdote, but so I won't talk out of my butt. I've talked to my friends who've been like, hey, where is this happening? And the one case, I guess, is in like I think it's Arizona or New Mexico, where, yeah, Phoenix, where the VA is trying to help people. So they, you know, when you have Congress and whatnot cutting their funding, you're going to have a problem then naturally of like, okay, we're trying to help more people. We don't have enough funding. And now there's the actual labor shortage that's resonating even in the private sector of hospitals. So, I mean, in the most concise nutshell in 3 minutes, I mean, that's essentially what it is, you know. So just, the VA is a good thing. And I mean, you know, if there was a veteran in the room right now who said, hey, I have a legitimate problem, I would hear it. But I've looked into it, and it's definitely a net positive. So anyway.
Thank you, Andy. Okay, we're gonna wrap it up with the reports.
I wanted to talk a little bit about ACO REACH. Is anyone familiar?
Yeah.
My boss has been a longtime advocate for stopping the privatization of healthcare. And last month, she actually led 70 lawmakers in calling on the CMS, Centers for Medicaid and Medicare Services, to implement reforms to Medicare Advantage to improve healthcare for seniors and people with disabilities. So unlike traditional Medicare plans, Medicare Advantage plans are administered by private insurers, and in recent years have been found to be fraught with fraud, waste, and abuse, and too often putting corporate interests over patient outcomes. So there is a parallel there, and a lot of what I've heard tonight connects. So I'm connecting the dots, and I have a lot to report back to my boss. So thank you for sharing your personal story. Yeah. I have a little bit more.
Okay,
to- I mean, do you all understand like ACO REACH?
Yes.
Okay.
You got the right age group.
Yeah.
Realizing private equity.
Stop it.
Yeah.
Stop it now.
I know.
Could you go ahead and define that was?
I was gonna say, I don't know what that is.
Okay,
actually.
sure. So ACO REACH, it's a very long acronym. It stands for Accountable Care Organization Realizing Equity Access Community Health. But it's no secret that our healthcare system is broken.
Yeah.
And there's a major problem in our country. When cancer rates spike at age 65, that's when seniors can finally afford to see a doctor when their Medicare coverage begins. So, and although Medicare is critically important to our healthcare system, it's under threat today, as you all know, and we are seeing an unprecedented encroachment of private interests in Medicare. And so that's exactly what ACO REACH is. It's Trump era. It's Medicare privatization hidden in bureaucracy, layers of bureaucracy. So ACO REACH allows private companies like health insurers, private equity firms, and more to administer Medicare benefits. So this dangerous program has no size limit, meaning that tens of millions of Medicare beneficiaries can be funneled into the program before we know for sure what it will mean for the patients. But we certainly have a good idea of how it'll look. Studies show that seniors consistently receive worse care under Medicare Advantage compared to traditional Medicare. So these profit-driven entities are encroaching on Medicare and our entire healthcare system, aiming to make money off of both patients and the federal government. And as of now, Medicare is letting them. So the Office of the Inspector General in the Department of Health and Human Services recently found that Medicare Advantage companies, some of the same companies in the ACO REACH program, inappropriately denied patient care in order to save money. So the ACO REACH program will only lead to more patient claims denied, more necessary treatments missed, and more patients falling through the cracks. So that's why the Progressive Caucus is calling on the Biden administration to fully end this program. So thank you all for your activism.
Thank you for coming. We'd like to open it up for questions or comments.
All right. We have two hands, yes.
Yes, I've been a surgeon at the AFGE for 30 years. And, observing it from the taking care of veterans over that time at that facility, the outsourcing of patient care is kind of a nightmare because it leads to total discontinuity of care. And so, one of the great things that the veterans point out is that you have care underneath one roof and there's continuity. And so by outsourcing it to all these different places, you can't access records, it slows things down, it leads to much worse care. The other thing I think is not widely appreciated, certainly by the press and by the public, is that the large VAs like in Seattle and LA, Boston, New York, major cities are closely tied with universities. And in fact, to be on staff of the VA, you have to have an academic appointment, which leads to a lot of access to tremendous care for veterans. And no private system is going to provide that. I think as people have pointed out, it's just not going to lead to better care for sure. And the last thing I've always been curious about is one thing I've noticed is that being a doctor there, is that the number of doctors and nurses remains about the same, but the number of administrators is actually I don't know how that leads to improvement.
Oh, my name is Beth Jamo, and I'm a AFGE rep. I know you all, and I think I've met you before. Fair practice coordinator. I do EEO cases and OWCP cases and stuff. But I worked for the VA for, God, I think I got 27 years in now. Well, mostly VA anyway. I'm administrative. I'm a medical support assistant. I get a front row seat though to the medical stuff. And about the serving some of the underserved, we have patients who they're in the hospital, their diagnosis or what they're in for is, they say, placement. So it's long-term, they're looking for a nursing home. It's not always easy to find that nursing home because this person might be well into dementia and maybe they're lashing out at people or, behavioral issues because of whatever's going on. So that's a hard placement. Some of those patients are with us a long time. I really don't think private hospitals are gonna be taking those people. And how many of those people, I don't know, because I don't know the insurance side of things, but I don't know if many of those vets have insurance. So what if we privatize? What's gonna happen to them? And I don't know if any of you watched that Michael Moore movie back when it came out called Sicko. But he said something in there about, he was talking about the survivors of the 9/11, the fighter fighters. And then he was comparing the care received in the US compared with Cuba. And I think on the World Health Organization's rankings of healthcare, not just based on technology, but on access to it, we were below Cuba. And Michael Moore had said something about, if this is how we're treating the best in the nation, what are we doing for everyone else? So the veterans are among the best in the nation, you know, and this is what we're trying to do to them. So, and then as far as Alton talked about the benefit side, I did work in we had a compensation and pension clinic, this is up here in the Seattle VA, and it was, I think, 2005, 2006, they shut it down, and it went to this company called THC, I think, no, TLC, Total Something Care, but it was this private company. So I don't know if it's still them doing the compensation and pension exam, Alton would know more than me, but we had compensation and pension exams done in the VA until about the end of 2005. Anyway, that's just my 2 cents worth. And staffing, you're right about staffing. It's shorter and shorter staffing.
Just a remark and then a question. I wanted to thank the doctor for showing up and tell him that I've always gotten respect and dignity from the VA, all of the staff, the docs, the nurses, all the staff. And I've been there 15 years or so. I just got my second knee done up there. It's been great. The second question I was addressed to you is what sort of, do you know anything about our 2 senators? I have heard a remark, I have not been able to find it online, that Senator Murray regretted her vote to privatize the VA.
Did she what?
Oh, she voted
She voted for it.
Read it.
And also
She
did, so did the other senator, Cantwell. But I don't know if, are you aware of any sort of regrets on their part? Were they a part of that group of people who went to, okay, but I mean, you could probably
I
find
can
out.
find out for you,
Yeah.
definitely.
Yeah, Patty Murray, there was, the 70, only 70 Democrats in the House voted against the Mission Act. And one senator, 4 people in the Senate, one of whom was Bernie Sanders, and a couple others were Republican rounds and so forth. So the majority of Democrats and the majority of Democrats in the House and Senate voted for the Mission Act. They then have expressed, sort of Patty Murray, buyer's remorse, but they have not pushed the secretary to revise the standards that could reverse outsourcing. And so, you know, the problem and it's the same problem that Sool, you know, described, is that you have a bipartisan consensus about privatization. And we need to, you know, get to those people and say this is an outrage, whether it's for veterans or anybody else, you know, post office or ACOE. My husband and I, we get calls, probably 5 calls, and I send Rachel Madley in your office. We get like probably 5 or 10 calls a day. You know, hello, I'm with Medicare Department of Health Services, Medicare benefits, Medicare, you know, these companies to try to sell us Medicare Advantage, and, you know, they pretend that they're Medicare.
It's fraudulent.
All right, let's hear from some folks that we haven't heard from yet. Yes.
I'm Sherry Weinberg, and I'm a retired pediatrician, and it's just reminding me that I did my psychiatry rotation as a medical student at the VA, which led to some interesting things because the locked unit has a key that looks like a caricature of a key. It's this great big heavy thing, and I had it in my pocket when I went to the airport. For something, not to go somewhere, but to pick somebody up or something. and the key caused problems. Anyway, that's just, but the reason I stood up right now is I wanted to kind of step back a little bit and take a look internationally about what happens to single-payer healthcare systems. And the most important thing is adequate funding. And in order to get adequate funding, they have to have buy-in by the population in general. So that if Netanyahu was trying to undermine the Israeli healthcare system, he'd have even more people out on the street screaming. So we've had problems when people like Margaret Thatcher decided to allow people to, doctors and patients to opt out of the national health system and see and what was called the gray market at the time. So doctors loved it because they could make more money, and so patients with means started to leave. And it has not really worked to undermine public support for the NHS, because that public support is there in England. But that is a serious problem here, that if we don't adequately fund our public systems like the VA, then the public says, well, it's no good, and they just short circuit it because they don't feel that buy-in to it, to say to the government, it's mine, fund it adequately. So when we think about trying to keep the VA and to move to some kind of a single-payer system for all of us, we have to have public buy-in to force our government to fund adequately, which means taxing us to pay for it. And we have to, the people in England are willing to be taxed for their NHS because they get it back in the service. So we have to get those messages across. So that.
And they still get to pay the royal family after. They will have no money left.
Thank you very much. Excellent point. Anybody that we haven't heard from, or any of the panelists would like to respond?
You know, I just want to say something about the most recent issue about toxicity, the PACT Act that was signed into law by President Biden, August the 10th, 2022, to address the toxicity of veterans who were exposed to toxic environment and throughout the world that made them travel, especially in Iraq and Afghanistan and other parts of the world where veterans have served, right? And so Sergeant Robinson, First Class Sergeant Robinson, he himself was a veteran, also was exposed to toxicity as he served his great nation. So now we have veterans who serve, who have respiratory issues, right? Who were not just like Vietnam, the Agent Orange, where the government were denying until Nemo, the veteran by the name of Nemo, sued the federal government, and the court sided with Nemo to provide care and also benefit to those veterans who served in Vietnam. 59 seconds on the ground in Vietnam, we were considered in country, so you could get any benefit that due to any kind of condition connected to Agent Orange. Same with the PACT Act, and most veterans today maybe have heard about it but don't know about it, but we're doing everything at VBA to make sure that every claim that comes into VBA, that we thoroughly inspect the records to make sure that if there's anything that we may see that is a possibility that this veteran may be eligible for benefit, then we make sure that we notify them that it's a possibility that you may be eligible for benefits so that I can get those benefits that it's rightly deserve. So it's a great thing, it's a good thing. So the package is there, and we're doing everything to make sure that veterans get their benefit that it's rightly deserve.
An excellent point. Suzanne and I just did an article, I think it's coming out this month in April in Progressive Magazine. It's kind of book related, and it basically asked the question, is the VA ready for this huge influx of PACT Act generated patients? I mean, if you've got 2.5 million people that are potentially exposed, And at the same time, you know, a third of the budget is now being drained away from direct care to reimburse VA contractors in the unsatisfactory fashion that we've heard described here tonight. There's going to be a lot of people not just waiting a long time for their claims to be processed because of the understaffing of the VBA. They're going to be shortchanged in terms of actual care if the first thing that happens to them after they get in the system is they're referred unnecessarily outside it to people who aren't going to treat them for burn pit related conditions as well as they would be treated within the VA. Virgilio.
Yeah, I just wanted to point out the point being made about funding is very important because that's how, you know, they undermine support for public services by defunding things, you know. Yeah, that we're not able to do our jobs to show the, you know, keep our standards high. Like a lot of people like work in these public, you know, facilities, and they're being shown that through underfunding, the service standards are going down, and then it's being used as a reason to, like, you know, cut services even more. But I just wanted to point out too that, yeah, workers in the postal service, a lot of us are veterans. There's also, we provide most of the mail-in pharmacy benefits for VA. That, you know, that's why support for the postal service is very important, because, you know, a lot of our veterans cannot go to pharmacy sometimes, and they rely on the mail to get their pharmacy benefits. So I do want to point out too that our contract with the National Social Security Carriers and the USPS is going to expire in May. We're in the middle of negotiations right now. And if there's any rally, you know, that you guys find out about supporting the Postal Service, please support it. You know, there might be one in the future for us as an NLC for Seattle. We might hear about it. Please support us. Come out and, you know, join us in a picket line or something. But yeah, I just wanted to thank you guys for, you know, inviting.
Thank you for coming. All right, anybody else that we have not heard from?
Oh, you've heard from me. I just want to make a comment to our brother there in the postal, we used to call him PL. You've got two people here who are former mail handlers and veterans, but you know, when I was working at the old terminal annex down, it's some of the hardest work I've ever done. I worked most of my life in construction. If you're on your feet for 8 hours a day, it's mandatory overtime, and you're shorthanded, you know, it's a you know, I'd go in there and lose 5 pounds on a shift, you know.
That's
It's hard, it's hard work.
That is
why
one
you're so skinny.
I know,
That is one thing that the public, well, they know about it right now. They see carriers out there like working up to the night,
Yeah.
and the understaffing after COVID has just hit us real hard, and you know, it's degrading our service. Like, we can't hire enough people because wages are not commensurate to the Seattle labor market. We're hiring at $22 an hour. We're competing with KFC down the street for $21 an hour, but the workload is totally different. We're out there like walking around or driving around all day, and you know, hopefully this is the first time we've seen an exodus of regular career carriers out of the postal service. This has never been heard of before. It's because we just don't have enough people that, you know, and management uses their management tactics to pressure us out even more. And you know, we don't talk about privatization, but you know, it's degrading service to the point that we might lose that 90+% support from the public. But it's a vicious cycle, you know. We don't have enough people, we get work too more, and then we lose more people, and then the service degrades. So this contract negotiation is very important, since management lost their ability to argue that, oh, we have this huge, gigantic debt that about, you know, postal health retirement benefits is gone. It's been wiped out. And hopefully, you know, but now they're coming up with this like new report just came out yesterday that we're losing so much money again. It's time that just when the contract negotiations are coming up, that we lost more than we expected. Like that's the phrasing they're using. So, you know, if we ever go into arbitration, because we're lucky enough as the Postal Reform Act, or I mean the 1970s, that we can go to arbitration. We don't have to go. We can't go on strike as federal employee, but we can go to interest arbitration. And at this point, like, let's go into arbitration because we have to protect other, we can present our case a lot stronger now compared to years before with that whole fake debt that they imposed on us by Congress.
Yeah.
Well, we're going head to head with Jeff Bezos.
Yeah.
Yeah.
That guy's, what's he got, 50 lobbyists in there
Oh yeah.
every day trying to get.
All right, so final words from Cam.
Yeah, I just want to make one comment. Suzanne's idea that instead of not just stopping the increasing privatization of the VA, why don't we just go the other direction
Oh,
Right.
and offer VA to all the veterans and family members? I want to point out that's not a radical idea. You look at any other economically prosperous free country in the world, they see medical care as a fundamental human right, and the government finds a way to provide that medical service to everybody and raise the taxes to pay for it. And guess what? They do it particularly half amount we pay per patient in this country every year because they have the efficiencies and the economies of scale that comes with an integrated medical care delivery system. I mean, it's a no-brainer to me. This country should have done a long time ago.
Marty, did you put your hand up or?
No, I didn't have my hand up, but I would like to say that I agree with your point that we should be not just demanding further privatization, that we should be demanding healthcare as a human right and full funding, priority funding for healthcare. And that needs to be written into our laws. It can't just be left as an administrative matter or a congressional matter to get funding every funding cycle. It has to be part of the whole project.
Well, that sounds like a great note to end on, and we'd like to thank you for coming. We have books,
Free copies of labor notes if you don't subscribe or don't see a hard copy that often. Extra copies of the AFGE sponsored report. And again, all proceeds for book sales go to Veterans for Peace. So
thank you so much.
thank you for coming. Great discussion. We need some for
When the union's inspiration through the workers' blood shall run, there can be no power greater anywhere beneath the sun. Yet what force on earth is